Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. As you start your week, please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 103,250 confirmed cases of COVID-19 in Canada and 34,654 cases in Ontario. Chatham-Kent has 157 cases, and Sarnia-Lambton has reported 285 cases. Michigan now has 63,261 cases, with 11,530 cases in Detroit. Today we are reporting 1,580 cases of COVID-19 in our community, an increase of 88 cases from yesterday. 87 people work in the agri-farm sector. 864 cases have now resolved. 451 people are self-isolating. 25% of our cases are between the ages of 20 and 29 years, and 23% are between the ages of 30 and 39. 62% are male, and 37% are female, with 1% unknown at this time. Our community has lost a total of 68 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 2 long-term care homes currently experiencing a COVID-19 outbreak, and there are 6 workplaces in the agriculture sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, or if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Ouellette Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates on COVID-19.
Good morning, everyone, and thank you for joining us again for our daily update. Yesterday, we reported our highest daily count of COVID-19 cases in our community. Today, we are reporting our second highest daily count of COVID-19 case in our community. Almost all of these cases reported in the last 2 days, including today, are linked to agri-farm sector and was identified as a result of the mass testing initiative. It was expected that the mass testing initiative will identify positive cases among the farm workers, but we are clearly seeing the numbers going up in that sector. Almost all of the workers at the time of testing reported no symptoms. Based on the high number of positives and with the ongoing testing initiatives, we are making a number of changes to our current approach. As many of you are aware, that public health system is generally 2% of the entire healthcare system, but is currently undertaking a monumental task of containing the pandemic in our region and also in the province. Recognizing the impact of these additional positive and the resources available to public health, we escalated the need for additional support for our health unit to the province and also to our colleagues in the province. Both Teresa and I were busy the entire weekend reaching out to various levels of government, ministries, the agri-farm sector, Ontario Health, etc., to ensure that we get the support we need to mount the appropriate response for this outbreak. On this note, I would like to welcome Dr. Alex Summer, Associate Medical Officer of Health for Middlesex London Health Unit, to assist us in the outbreak. Dr. Summers will be with us for at least a few weeks to support our team in managing the agri-farm outbreaks. I want to thank Middlesex London Health Unit for extending their support to us and seconding Dr. Summers and 2 additional staff to support the ongoing work at the agri-farm sector. With the additional staffing support from the other neighboring health unit as well and the unique needs of the temporary foreign workers program, our team of nurse practitioners, public health inspectors will be on site to do a health assessment on all these workers who are tested positive and interview them for case and contact management. Based on the interview and health assessment, we will have a better understanding of these cases, their current health status, and any other issues. All these cases will be re-swabbed to rule out any false positive. This will also help us in making an informed decision on the ongoing outbreak case investigation and outbreak management. In addition, we had a number of conversations for the ongoing need for better education of the temporary foreign workers, controlling workers' movement from one farm to another, enforcement of isolation requirement, accommodation needs for these workers, testing and follow up all these positive cases. We will continue to work with all the health system partners, various levels of government, to ensure that our local community is safe, the workers are safe, and getting the appropriate support that we need to contain the spread of COVID-19 in the best possible way. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with AM 800.
Dr. Ahmed, how concerned are you with the past 2 days, the numbers? These individuals, I'm guessing, were out and about the community prior to being tested. How concerned are you that this virus could have spread to others?
So it is, I guess, a heightened concern from everyone at this point, and many of these farms have different living arrangement for their workers. A lot of these workers are on the farm property. They are their accommodation is right there, and then there are workers that are also living out in the community. So we've got a mix of all these people. Recognizing that anyone who is tested positive, they are required to self-isolate. So the need for people who are diagnosed, they need to be self-isolated. And I think as a community, we all recognize that anyone you are coming across with in the community could potentially be a case. So all these precautions are necessary at all times. And it just highlighted the importance of following all these recommendations at all time for physical distancing, hand washing, recognizing that when you have any of these symptoms, you have to stay home. So I think combine all of these measures, that's the only way we can get through with that. I wouldn't say that anyone who's outside could, especially if they're temporary foreign workers, they could be at risk because, as I said, almost all of them are supposed to self-isolate, and they are following that requirement. And still, we are talking about a large number of population in our region. We have more than 8,000, close to 10,000 people, temporary foreign workers in our region. And so far, what we are dealing with is still cases that are active. So just finding the right balance to not to paint using the same brush that anyone who is outside could be a case and spreading it to the other individuals.
Are you anticipating these numbers to be this high, and who knows, maybe even higher this week and even next week? Is that what your gut feeling's telling you, that these numbers will remain high?
Well, I think we have seen a variation of all the possibilities. So there are farms that were tested and all of them came back negative. And then there are farms which is showing a high positive rate. And then you have farms that are showing a limited number of cases, then eventually they came back as negative too. So I think it is a possibility, but unless we get more farms on board, we can be in a better position to comment what these case counts look like. But as of now, what we are dealing with is absolutely it's unprecedented, and nobody was expecting this high number. And I think as we continue to work with all these cases and contacts, we will have a better understanding of what the ongoing risk in this population is, and we'll work accordingly. The good part is we have all the levels of government, all the ministries, and everyone involved and engaged in this conversation. And with all the support, hopefully we will come together with a better plan. And everyone needs to add their their part to the overall plan to protect these workers.
Thank you.
Any questions?
Questions from Windsor?
On Sunday, the health unit said 96 of the new cases were discovered through targeted testing at one agri-farm location. Were today's cases at that same location, or is it several locations?
They are all part of the same workplace, and that's what we are working with right now. Our overall workplaces that we are dealing with, that still stays the same.
And over the weekend, were there any enforcement actions against any patios or other businesses that had reopened under stage 2?
We got some complaints. Our tobacco, vaping, and enforcement officers were out, and they did a lot of education and enforcement. And we're hoping that through this education initiative, people will continue to follow the recommendations of public health and keep themselves safe and everyone else.
Thank you.
Any questions?
Questions from the Windsor Star?
The outbreak in the agri-farm sector, it looks like it's becoming an increasingly more of a public health concern risk. Will you name the farm where this outbreak is occurring?
So we have obviously are trying to look at all these cases and contacts and try to understand what is the risk to the farm, the risk to the community, and the ongoing risk of transmission. So we will be looking at all of these issues and report accordingly back to the community.
So can you name the farm?
Well, at this point, as I said, we'll have to look at assess the risk to the community, and if there's a risk to the community based on the farm, we will do that. But at this point, we're just collecting information to get a better handle, and then report accordingly.
Okay, can you talk about what with Alex Summers, like the extra people coming in, will actually be doing here?
So given the high number of cases, every case requires a good case and contact management and interview, and the assessment whether this person is a current case, active case, infectious, non-infectious, symptomatic, asymptomatic, and part of that is expanding the circle to link all these cases to the exposure, where these exposures are happening, whether at the accommodation, whether at the workplace, and how all these cases are linked. So it does require a little bit more deeper analysis of everything that's happening. So all the support that we are getting would be focused and dedicated to the case and contact management of all these additional workers, recognizing that following up with more than 160 or 170 cases in the 2 days that we have seen, it's unmanageable by any single agency or any other public health unit. So I think that's why the support is there, and we're getting also support from the different levels of the government too. So all of these resources will be dedicated to the case and contact management to help assess the situation and help put better controlled measures to prevent and limit the spread of COVID-19.
Thanks.
Any questions from CBC?
Yes, good morning. I heard you say that almost all of the workers at the time of testing reported no symptoms. Is this because they were asymptomatic, or is this a bit of like some of the challenges you mentioned before where they don't want to maybe say that they're feeling ill?
So it would be hard to say what that looks like, but obviously when these testing are happening, these mass testing initiatives, they try to assess some of that symptom at that time, and whatever they report, they document it. Our team of nurses, when we are interviewing them, we are doing a health assessment on them, and some of them show some symptom. So I think that's why it is important that the in-person health assessment is done. So our team will be out today and maybe tomorrow as well to do that in-person assessment to make sure that we are not putting anyone at risk, the health worker, the agri-farm worker, and also the workplace itself and the community. So that's why it is critical that that assessment happens, and we are dedicating all these resources to do that assessment in person, to get a better handle, to know exactly what we are dealing with, and then put control measures in place.
But if these individuals are asymptomatic, and there's quite a lot of them, they'd be allowed to just go back to work under the province's guidelines, correct?
Well, I guess there's a lot of flexibility in terms of how we are investigating all these cases, and as a local medical officer of health, we'll have to assess the situation based on the information that is available to us. And once we do all these case and contact management interviews and collect all that data, we will be in a much better position to say if and how many or if no one will be allowed to go back to work. As of now, all the positives, they are self-isolating until we do the interview and have a good understanding of their symptoms and their ongoing risk to the community and to their fellow workers.
Okay, thank you.
Any questions from Blackburn?
Just to follow up on some of those questions, if they were a lot more asymptomatic cases than ever we've seen, is this a concern? I mean, previously when you've done this mass testing in the long-term care homes with the random testing, asymptomatic cases were few and far between. So is this a concern that you're possibly seeing more asymptomatic cases?
Well, one of the biggest concern, and as we are learning more and more about this industry, is the role of contractors in many of these workplaces. And the underlying hypothesis is many of these places employ contract agencies to support the ongoing work, and these contract agencies are bringing people who could potentially be infected or maybe acquired the disease, either or, but then movement from one farm to another potentially contributed to that. So that's something that's important to know. The other part is that yes, there's a difference when we're talking about the long-term care home and the testing here in these agri-farm. As much as we can say that the total number of farms that we are working with, it's unchanged. So basically, any of these farms already had cases. What we are noticing is once it's in the farm, it's basically the likelihood of everyone contracting is much higher, and I think that based on that, we need to put really strong control measures in place in each of these farms to prevent it from spreading. Many of the policies, many of the recommendations have been communicated extensively right from the beginning, from January, February, up until to this point, and with further enforcement orders under the authority of the medical officer of health has already been put together for all these farms. Recognizing that there's still the ongoing need for communication for especially with these temporary foreign workers and their understanding of COVID and their understanding of what they need to do from a physical distancing measures, from an accommodation perspective, from ensuring that they're using all the right measures to prevent the spread. So I think that work is definitely needed and will continue to be an ongoing work with all this agri-farm sector.
But I know you said you're going to do these assessments still, but are you assuming then that at some point most of these people did have symptoms at some point, even though they reported they were not having symptoms?
That's the idea, that when we do the interview, we would like to do a good assessment on them to identify whether they are currently infectious and are currently symptomatic, and as we know the limitation of the PCR testing, it cannot differentiate like a more recent disease because the PCR can be positive for up to 4 to 6 weeks, and with the new evidences, even the recommendation is not to do a repeat swab in the next 90 days because the person can still be positive. So what we are trying to assess based on a good interview and good health assessment, that if any of them had any recent infection, maybe a month ago or 2 months ago or close to that time, or if they were truly asymptomatic up until the time when they were tested right now, and to make that distinction whether they are currently infectious or not. So that's the hope, and with the high positive, it would not be an unexpected finding that some of them have had previous infection that are already resolved, but we can only say with certainty after doing all these health assessments.
Okay, so just to make sure I'm not hearing you wrong, your assumption right now, I mean, you're going to look into it obviously, is that some of these people may have been infected right at the beginning of the pandemic, or within the few weeks of heading over here, and now they're no longer infectious?
That is what that's what I'm saying.
Okay.
Any questions?
From CTV.
Yes, good morning. So, Dr. Ahmed, if I understood your previous answer correctly in terms of naming the outbreaks in the agri-farm sector, at this point you're looking to collect more information before releasing any further information. So is there a point in the near future where we can expect the health unit to name those farm outbreaks like it has for LTCs?
Well, I think we'll have to go back with the existing laws and legislation about the privacy and the impact on it. So under the law, we are required to report all these long-term care home outbreaks and LTC retirement home outbreaks publicly. The rest of the facilities, the workplaces, obviously there's an element of the risk to public. And we know that many of these agri-farm sectors are not open for public. There is no public going in and out, and the risk from these outbreaks or facilities is pretty much negligible from a community perspective. What we will try to assess is if these workers, where these workers are, what are the risks to the community, and if there's any risk to the community, absolutely, I think that's we'll be notifying them. But we will also have to recognize that if it would be linked to the facility itself, and the facility would be the source of this concern, or it would be just the people who could be anywhere in the community and could be potentially at the risk. But the important piece is anyone who's positive, they need to be self-isolated, and I think that's where we are working on to protect the risk of spread in the community. So even though we have a high number, what we are seeing right now, but if all of them are self-isolating as per public health recommendations, the risk, the ongoing risk to the community is still something that what we can say is contained. And as a community member themselves, I think we have done an excellent job in keeping ourselves safe, keep reducing the spread in the community at a minimum for the entire duration of the pandemic. So I think we as a community, we know what we need to do. We just continue to do the same, even though when we're talking about stage 1, stage 2, physical distancing, hand washing are still the critical element that we can do to protect ourselves and the rest of the community.
Well, while these farms aren't generally open to the public for public use, would these farms have to disclose that they're an outbreak to contractors, like you had mentioned, are coming in to do work? If they're hiring anybody to come in, are these farms and greenhouses required to disclose we're an outbreak as per the health unit?
So I think that's something that we are also trying to contain, the movement of workers from one farm to another, and just like any long-term care home or anywhere else, if a facility is currently under outbreak, anyone who's coming in and going out to the facility, I think it's important for them to disclose that and to share that information with the rest of the group. But having said that, I think the key issue is we like to have a better handle on these contract workers as well, because we don't want people to go from one farm to another, and that is something that we were working really hard to control, because that's the important mode of transmission from one facility to another, and we really want to control that movement.
And just further to the assistance coming from Middlesex, London, is that going to be a whole team that's coming down, or is it just the one person? What is that going to look like?
So right now we know we have Dr. Summers coming down. He's here in the building today. We have heard at least 2 people will be coming in person to assist us with the case and contact management. But the call has gone out to other health units as well, and we have had at least 10 more staff that we know from different health units will be supporting us, and the ministry is also providing us with more support. So hopefully a combination of all of that would help us manage in the short term, and it will definitely help us get through some of these answers that we are looking to manage this and put specific control measures in place.
Okay, thank you.
further questions from AM800?
Yes, Dr. Ahmed, over the weekend, the Windsor Star had an article talking about Leamington and the situation with the mayor sending you an email back in April asking for mass testing being done for the agri-food sector workers. Do you think the health unit missed the mark here and should have done the testing back in April once the mayor sent you that letter?
Well, I guess throughout this pandemic, everything is evolved right from the beginning. The testing strategy, the resources, and everything, the way all this infection is spread. If someone can go back and say, well, we warned you about this pandemic that it will come to Canada or into the world, did everyone miss that mark? So I think it would be unwise to say that it was not under the attention. Public Health Unit has been working with these farms, with this industry, right from the February, even the beginning of the pandemic, because we have worked with these farms even in the past and how it spread. The real issue still remains is the accommodation and their congregate living settings. And if everything, we put everything in place, but one case, which is a strong possibility in the population of 8 to 10,000 people, if one case is there, they can potentially infect it to other 15, 20 people who are living in the same household. And then extending it further, if they're not educated enough, if they do not understand their responsibility, the workers, and they can potentially spread it to another worker, and then it just multiplies exponentially. So I think what we can say is we followed every best practices. Our health unit was on top of many of the initiatives that we have put forward, many initiatives that other health units followed after. Some of the examples we talked about, the early closures of many of the businesses in the beginning of the pandemic, the issues with the border crossing, the issues of mandatory masking. The health unit is on top of most of the things, and right now what we are dealing with just the magnitude of the problem. Nowhere else in the province of Ontario has that many temporary foreign workers in the region. So it is important for us to recognize that, and what we are dealing with is, again, those issues go beyond public health. So that's the critical piece. I think we want to make sure that people understand that public health role, as much as it's being highlighted more and more, public health role is very different, and the issues that we are dealing with is not public health issues. It goes beyond that, and that's where we need the different levels of engagement from the government and different ministries to come down and support us. So overall, I would say that that work needs to happen, and it should happen, and it continues to happen, to find a much better longer-term solution.
One follow-up here, sorry. But if mass testing would have begun 2 months ago, like the mayor of Leamington suggested, wouldn't the numbers that we're seeing now, the 88 and yesterday's high number, wouldn't those numbers be, I guess, higher 2 months ago when the mayor asked for the mass testing to begin compared to now?
So I think, Rob, we talked about this a few times, that testing is not preventative. And I think that's the key that we have to recognize. Unless we change the living situation, the testing probably would have given, you have low test count. And then maybe we live in this false sense of security that, okay, everyone is negative, then we don't need to take any measures. So we have to be very clear, this testing is not a preventative measure. It's a point in time, and it only tells you what is happening currently. And if we haven't tested, that doesn't mean that we don't know what's going on. If we even after testing, the biggest issue that we will be dealing with is how do you house these people? How do you cohort them appropriately? And if people are still living in this congregate setting in high numbers, what would be the other risks that we are talking about? So I think the real issue here is not testing. Testing is help us in understanding the situation, but testing is not preventative, and I cannot emphasize it more. I've been saying this right from the beginning. Testing is not preventative, and it can only give us a point in time what we are dealing with.
Thank you.
Any further questions?
From Windsor-Essex?
On Sunday, the health unit reported an additional long-term care outbreak at Extended Care Tecumseh, and it says that one resident tested positive. How do you think that a resident tested positive, considering the precautions that are being taken in long-term care homes?
So without getting into the specific personal details of that case, all I can say is there could be many reasons for that, and we're actively looking at all the reasons. And we know that despite all these measures, there are now some of these facilities are open to public. Where people are visiting there, and also there could be workers who are working in the facility and going back in and out. But having said that, that's I'm not suggesting that any of this contributed to it. But what I can tell you is there could be many reasons for a new case introduced in the long-term care home. Same idea. We tested all these long-term care homes. And the screening results came back, gave us a picture of what happened. It was not preventative in the first place. The prevention measure still goes back to the entire practice of education, infection prevention and control measures, and having appropriate personal protective equipment to prevent and limit the spread of the disease. So these measures need to be continuously enforced and have to be in place to ensure that we are not introducing any new cases in these facilities. So same idea, if we can just take it and translate it back to the farms, unless we have all those measures in place, we cannot say, or no one can guarantee that this will be a preventative measures, even if we test everyone in the farm in our region.
Any further questions from the Windsor Star?
No, thanks.
CBC?
Yes, talking about those contract workers and agencies, has any farms or businesses been fined under the order that the health unit issued that said that these workers were not allowed to work at various places?
So health unit hasn't issued any fines at this point. There are a number of investigations that the Ministry of Labor is conducting, and workplace regulations and workplace enforcement. Typically, that's the Ministry of Labor who's doing that. Health unit is obviously providing this specific requirements to prevent and limit the spread of COVID-19. So that work is already there, but the enforcement part is mainly done at the workplaces by Ministry of Labor.
Then why issue an order if you're not going to follow up on it?
Well, the order is to assist other law enforcement agencies, other groups to know what is expected of them. So even the Ministry of Labor and the provincial police, Ontario Provincial Police, they can act upon our order. That's why these orders are there. This is why it's a provincial. It follows the Health Promotion and Protection Act, which is a provincial act, and the agencies that are responsible for the direct oversight of all of these businesses and services, they can take action based on the order that we have issued.
Thank you.
Any further questions from Blackburn?
No, thank you.
ETV?
No, thanks.
Thank you, everyone.